Welcome back, everybody, to another deep dive. And today we're talking about something that everyone has some experience with. Teeth, obviously. We all have them, and we've all probably heard some pretty strange things about how to take care of them, or maybe what will happen if we don't.
Yeah, for sure. There are a lot of myths out there when it comes to dental health.
Exactly. And you guys have sent in a ton of questions about some of these myths, so we're going to be diving into today, trying to separate fact from fiction. And we're going to be using this great podcast we found called Easy Dental. Have you heard of that one?
I have, yeah. They've got some really good information on there.
Right. Like I was surprised by how much I didn't know. So are you ready to tackle some of these myths?
Absolutely. Bring them on.
Okay. Well, let's start with one that I always kind of wondered about. Does pulling a tooth really, mess with your eyes or even cause headaches?
Oh, that's a classic. It's actually a pretty common concern, but the truth is that there's no real anatomical basis for it. Yeah. I mean, think about it. The nerves and blood vessels that go to your teeth are totally different from the ones that go to your eyes and head. They're on completely separate pathways, so pulling a tooth isn't going to send shockwaves up to your eyeballs or anything.
Okay, so it's not like they're all connected somehow.
Not at all. A good dentist, a qualified dentist, will understand those pathways and can do an extraction without putting your eyes or your head at risk.
That's a relief.
Yeah.
But what about, okay, this one's kind of weird. Is it true that having your teeth cleaned too often can wear away your enamel? Is that really a thing?
That's a myth I hear pretty often, too. And I think it comes from the idea that we're scrubbing away at our teeth like we're trying to sand down a piece of wood. But professional cleanings are different.
Okay, how so?
Well, think about it. Enamel is actually really strong. And professional cleaning uses special tools, often ultrasonic ones, that specifically target the stuff that can damage your enamel. Things like plaque and tartar.
So it's more about removing the bad stuff.
Exactly. Those ultrasonic vibrations break down the harmful buildup without harming the enamel itself.
Okay, that makes more sense.
Yeah.
But what about those super powerful cleaning tools that dentists use? You know the ones I mean.
Yeah.
Is there any truth to the idea that those can actually weaken your teeth?
Well, if your gums are healthy, professional cleaning won't weaken your teeth at all. It's actually the opposite. It can really help to strengthen your overall oral health.
Really?
Yeah, because by removing that buildup that irritates your gums and causes inflammation, it's kind of like preventative maintenance, you know?
Yeah.
Keeping things clean and removing the potential problem areas actually helps your teeth stay stronger in the long run.
Huh. Because I never thought about it that way. All right, this next one is a bit of a scary one. What about the idea that dental treatments like fillings or root canals can cause cancer?
Yeah, that's definitely a serious concern. But the truth is, those treatments themselves don't cause cancer.
But I thought there was some link between oral health and cancer, right?
Correct. Well, there is, but it's not a direct cause and effect kind of thing. What we see is that oral infections, often related to things like using tobacco, can worsen existing cancers. It's about the overall health of your mouth, not the treatments themselves.
So good oral hygiene is important for your overall health.
Exactly. It's all connected.
Okay, good to know. Now, this next one, I'm sure we've all heard as kids, right? Baby teeth don't need treatment because they're just going to fall out anyway.
Ah, yes, the classic baby teeth myth. It makes sense on the surface, but unfortunately, it's just not true.
So it wasn't just my mom trying to trick me into behaving at the dentist.
No. Baby teeth actually play a really important role. They help to guide the development of your adult teeth.
Oh, really?
Yeah. So if you have cavities or infections in those baby teeth, it can actually affect how your permanent teeth come in and how healthy they are.
Wow. So taking care of baby teeth is super important for long-term oral health.
It really is. It's about setting good habits early on.
Okay, good to know. Now, this one always makes me laugh. Is it true that brushing more often means cleaner teeth? Is there a point where it's just too much?
Well, it seems logical, right? The more you brush, the cleaner your teeth should be. But it's not quite that simple.
So, there is such a thing as overbrushing.
Yeah, there is. Especially if you're using a hard bristled brush and scrubbing too hard.
Really? How come?
Remember how we were talking about enamel being strong but needing protection? Well, overbrushing can actually wear away that enamel and do more harm than good.
So it's almost like the cleaning myth, but from the opposite end of the spectrum.
Yeah, exactly. It's all about finding that balance, consistent cleaning with the right technique and the right tools. And that's where a good dentist can really help you.
This is great. I'm learning so much. We've already busted a bunch of myths and we haven't even gotten through them all. But We'll have to save the rest for next time.
It really shows that you got to pay attention to the details when it comes to dental care.
Yeah, like there's a whole science to it. Okay, speaking of details, what about this one? Chewing sugar-free gum after a meal. Is that really as good as brushing? Like, can I just skip the brushing and pop in some gum?
Well, not quite. It's not that simple. Chewing sugar-free gum does have some benefits for sure. Like it helps produce more saliva.
Oh yeah, I've heard that.
Right. And saliva helps to neutralize the acids that can hurt your enamel after you eat.
So it's kind of like rinsing your mouth, but without actually using water.
Yeah, you could think of it that way. But gum can't really remove plaque and food particles the way brushing does. It's not actually cleaning your teeth.
So it's more like a little bonus, not the main event.
Exactly. It's a good supplement, especially when you're on the go.
Yeah.
But don't ditch your toothbrush just yet.
Okay, good to know. What about this one? Do you really only need to see a dentist if you have a problem?
That's a myth we dentists would love to bust. It's like waiting till something breaks before you try to fix it. You know, going to the dentist regularly can actually prevent bigger problems down the road.
So like regular checkups are important.
Yeah, it's all about preventative care. Think of it like taking your car in for an oil change. You don't wait until the engine blows up, right? You get those regular checkups to catch any problems early.
That's a good way to put it.
Okay.
Is there any truth to the idea that teeth whitening can damage your enamel?
Well, it depends. Some of those over-the-counter whitening products, especially the ones that use harsh chemicals, can potentially damage your enamel, especially if you're not using them properly. But professional whitening done by a dentist, that's usually safe and effective.
Do they know what they're doing?
Exactly. They use controlled techniques and higher quality products, so there's less risk of damage. Like the difference between, say, dyeing your hair at home versus going to a salon.
Yeah, that makes sense. Okay, this next one I always hear, and it kind of makes me cringe a little bit. Is flossing really necessary? Like, can't she just brush really well and skip the floss?
Oh, I hear this one all the time, and it's just not true. Even if you're a superstar brusher, your toothbrush just can't reach every nook and cranny between your teeth. That's where floss comes in.
So it's like getting into those tiny spaces.
Yeah, it's like cleaning those hard-to-reach spots that your brush misses. Flossing helps to get rid of plaque and food debris in those areas, which prevents cavities and gum disease.
So flossing is kind of like a full coverage cleaning for your teeth.
Exactly. You need both brushing and flossing for a truly healthy mouth.
Gotcha. What about bleeding gums? Is it normal to bleed a little bit when you floss? Because I have to admit, I've seen some pink in the sink, but I didn't think too much of it.
Well, a little bit of bleeding every now and then, especially if you're new to flossing or if you've started using a new toothbrush or something, that could be totally normal. Like a tiny little scratch, it heals up quickly.
Okay, so a little blood isn't always a bad sign.
Right. But if your gums are bleeding a lot, or if it's happening every time you floss, that could be a sign of gum disease.
No, that doesn't sound good.
Yeah, gum disease is an infection, and it can actually damage your gums and even lead to tooth loss if you don't take care of it.
So if I see a lot of blood, I should probably make an appointment.
Yeah, definitely. Your dentist can figure out what's going on and recommend the best treatment. Early intervention is key for healthy gums.
Makes sense. Okay, last one for this round, and then we'll take a quick break. What about mouthwash? Is that like a good alternative to brushing if you're in a hurry?
I wish it were that easy. But no, mouthwash can't replace brushing and flossing.
Okay, but it does something.
Of course. Think of mouthwash as a way to freshen your breath and kill some surface bacteria. But it doesn't have the cleaning power to really get rid of plaque and food debris. For that, you really need to brush and floss.
This is more like a finishing touch.
Exactly. It's a nice addition to your routine, but it's not a substitute for the real deal.
All right, well, I think we're making some good progress here, busting all these dental myths. We've still got a few more to go, though, so we'll be right back after a quick break with more myth-busting fun. Okay, we're back and ready to tackle a few more of these dental myths. What else you got for us?
All right, let's talk about electric toothbrushes. Are they really better than regular toothbrushes, or is that just hype?
Yeah, that's a good one. I've seen so many different kinds, but I never know if they're actually worth it.
Well, they're definitely not just a marketing gimmick. Electric toothbrushes can actually be a big help, especially for people who, maybe have trouble using a regular toothbrush, like if they have problems with their hands or just can't seem to get their teeth really clean with a manual brush.
So they can make a difference?
Oh yeah, for sure. That oscillating or rotating motion of the brush head, it can really get rid of plaque and debris much more effectively than you can with just a manual brush.
Like a power tool for your teeth.
Kinda, yeah. But manual brushes are still fine, if you're using them correctly. It really depends on what works best for you. Some people just prefer the feeling of a manual brush, and that's totally fine.
So it's not one size fits all.
Right. The most important thing is to find what you like and then use it consistently with the right technique.
Gotcha. Okay, what about braces? Are those just for kids?
Nope, not at all. A lot of people get braces when they're teenagers, yeah. But there's really no age limit for orthodontic treatment.
Really? I've been seeing more and more adults with braces lately.
Right, it's becoming much more common. And it's not just about aesthetics either, having straight teeth.
Yeah, I was gonna say, it's not all about looks, is it?
Definitely not. Straight teeth can help you avoid a lot of problems, actually. Things like jaw pain and headaches, even problems with chewing and speaking.
Oh, wow, I never thought about that.
Yeah, it's pretty amazing how much your bite can affect your overall health.
Okay, last myth for today, and this is one I've always wondered about. Do wisdom teeth always need to be removed?
Oh, wisdom teeth. That's a big question. And the answer is, it depends. Not everyone needs to have their wisdom teeth taken out.
So how do you know if you need to have them removed?
Your dentist will keep an eye on how your wisdom teeth are growing in. Check their position and see if they're going to cause any problems.
So what kind of problems can they cause?
Well, sometimes wisdom teeth can get impacted. That means they're stuck and can't erupt properly. And that can lead to pain, infection, crowding, even damage to the teeth around them.
So it's better to get them out before that happens.
Exactly. Sometimes it's best to be proactive and avoid those problems altogether.
Okay, that makes sense. Wow, we covered a lot today. I think we busted pretty much every dental myth out there.
I think we did a pretty good job. Hopefully our listeners are feeling a little more informed now.
Yeah, and less worried about all those scary dental stories. It's so important to have the right information, so you can make good decisions about your health.
Absolutely. Knowledge is power, right? And when it comes to something as important as your oral health, it's worth taking the time to learn the facts. And of course, always talk to your dentist if you have any questions or concerns.
That's great advice. And that's all the time we have for today. But hopefully this deep dive has given you some food for thought and maybe even inspired you to take better care of your smile. Thanks for listening, everybody, and we'll see you next time.